My name is Elizabeth Cisneros. I have been a neuropsychologist here at Casa, Colina for the past 14 years. I'm the director of the Department of Neuropsychology and Psychology, and I do almost all of our outpatient neuropsychological evaluations. So if you ever come back to see us as a patient to get an evaluation, you'll probably see me. But thank you so much for the opportunity to talk to you all. This is a talk that I really love. It's a topic that I'm really passionate about and something that I think all of us, no matter what age we are, it's always important to keep in mind. Let's talk about overall what our philosophy is, and it's really one of wellness, right? And wellness can be thought of in a few different ways, which can be, the state of being in good health as an actively pursued goal. I took that from the illustrious citation of dictionary.com. So I thought that's a really good definition, though, right? It's something that doesn't just happen to us, but we have to actively pursue wellness, right? And the World Health Organization says that wellness is a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity, right? So it's not just existing, but really thriving, right? And that's our kind of philosophy here as we talk about aging, and in our senior evaluation program, that is one of the main focuses that we have, is life that is good and well-preserved and full of enjoyment, right? So there's recently a study, and it asked a whole bunch of seniors, what are your fears about aging? What do you think those might have been? What do you think the top ones would be? Anybody want to? Your brain, okay. Yeah, okay. Any others? Your body giving out, okay. That's a big fear as well. Anything else? Death, okay. Yeah. Run out of money. It's I think they surveyed you guys, because the number one was the fear of losing one's memory, right? Number two was developing health problems. Number three was not having financial security. And then number four was becoming dependent on other people, right? And all of these things are certainly all related, and certainly fears that kind of go along together. And so it's something that we always want to keep in mind when we're trying to address what long-term health looks like. So when we're talking about healthy brain aging, I think it's important to talk about the whole lifespan. How do our brains age? Well, when we're tiny little people, right, it happens so automatically. There's such rapid brain development that happens from the time that we're conceived till about age 3. It's just this rapid explosion of development. And by the time we're about 5 years old, our brains are about 90% developed. Unfortunately, that rest of that development doesn't really happen until we're in our 20s. And so if you remember having teenagers, as I do, then you can fully attest to the fact that full brain maturity does not happen in their teens, does it? And so our brains basically reach maturity when we're in our 20s, and that's the time that we finally have all those well-developed reasoning abilities. That's when our parents get a lot smarter, all of those kinds of things, right? So that's also the time that I get my students in. And so I tell them, like, you guys just don't know, but you're already at the peak of your brain's efficiency. So the speed that our brains work actually reach their peak in our 20s. That's why they're so fast when they make bad decisions, right? So, and then between our 30s and our 40s, our brain volume actually goes ahead and starts shrinking just a tiny little bit. We don't notice it, but it does start to shrink a little bit. 40s to 50s, we start noticing a little bit of shortening of how much we can hold in our brains at one time, right? If you remember the days when we looked up phone numbers in a phone book, right? How many of those digits that we were good at being able to hold in our heads at the time, we don't have to do that now, right? But the amount of information that we could hold, that starts to shorten a little bit in our 40s to 50s. And then things start changing a little bit more from about age 50 to 70, and we get a little less efficient with like multitasking, little more likely that we're going to have some difficulty coming up with the right word. We're going to have to repeat things a few more times before we learn them. However, here's the important thing. There's also a trade-off, because actually it's at this age, between 50 and 70, that what we call crystallized intelligence, which is kind of the accumulation of a life's worth of knowledge and experience, it all comes together. So there really is a trade-off, because even though there's some changes in the efficiency, you've got a tremendous amount of wisdom and experience that balances all those things out. So it's really kind of fascinating how our brains do work that way. And then starting at about age 70, that's where there really starts to be some more variability between different folks. That's when more changes related to things like memory start to develop. For most folks, though, after age 70, we see that reasoning abilities, language abilities, all those we know how to do it kinds of things, and creativity remain really sharp, right? Now, but this is also the time when genetic factors, lifestyle factors, and various health issues, those start to create more of an effect on somebody's cognition. So that's when we really start to see those changes and differences starting to come into play. So I think it's really important that we're aware that cognitive aging is not a disease. It's not a disease, it's just a normal human process. And it actually unfolds throughout our life, right? It starts when we're just tiny infants, and it goes on throughout our entire lifespan. And it's not the same for everybody. If you can remember back in your elementary school, you had kids who were naturally better at some things, right? There were the kids who were the bookworms, and then there were the kids who didn't do so well with reading and with books, but golly, they were sure good at putting things together with their hands, right? So lots of strengths and weaknesses that kind of across the lifespan really capture the different parts of our cognition. But there is a wide continuum of aging and how it affects cognition, right? But the rate of changes in thinking abilities and the extent of individuals' cognitive decline is not something that is wholly inevitable or irreversible. So that's the important thing that I want us to be aware of, is that changes in our thinking abilities are not just a fixed fate that we're destined to, right? So there are things that are not within our control, and we could focus on that, but probably not a lot of good in focusing on those things. Instead, we're going to really focus on the things that are within our control to modify and change. So across the lifespan, our brains are super efficient, and they're always changing. Our brains are incredibly resourceful and efficient. It tries to be efficient with its resources, and when we have connections to memories and knowledge in our brains, if we use them, those connections stay really strong. If we stop using them and we don't keep those pathways and connections strong, our brains do a really efficient job of cleaning them up and getting rid of those neuronal connections, right? And so that can be efficient to get rid of certain things that we don't need to have knowledge of, but it is also a situation where if you don't use it, you lose it, right? And so that's why we're going to be talking about a lot of the recommendations that we have on that. Now, there are so many different kinds of factors that influence how somebody's brain ages, right? We've got physical abilities, we've got their emotional functioning, we've got just natural intelligence, We've got factors related to socialization. Even what job that you did throughout your life has a big effect on how your brain ages later in life, and spiritual effects as well. So all of the things that make us who we are as individuals all have effects on how our brain ages. So there are normal changes that happen in aging. And so we all hear about senior moments, right? Right? Senior moments are a real thing. It's a real thing, doesn't mean anything terrible. Okay? Normal kind of things. Golly gee, cannot find my cell phone while I'm talking on it to somebody, right? Lost my keys. Had to find them. Had to use I have to have a little tracker, right? On so I can make sure I know where my keys are, right? Not remembering somebody's name when you see them out of context, right? I used to joke that the worst night of the year for me working here at Casa Colina was our holiday party, because suddenly all the people that I work with all day long, in one context, I see them and I need to introduce my husband to them, right? And the pressure of coming up with a name at that moment, right? It's rough, right? On the spot. That's a totally normal kind of thing, especially because you're seeing them out of context and you're put under pressure to come up with that name immediately. Struggling with new technology. Yeah, that's a normal kind of thing, to struggle with it. It's a normal kind of thing. Occasionally not being able to think of the right word, and what's that thing, that kind of thing. That's all perfectly normal aging kinds of things. Taking a little bit longer to get things done. All of those are normal kinds of things associated with just normal changes in aging. But the key factor in all of these things is that they do not interfere with somebody's day-to-day functioning. The difference in what's normal aging and what could be a concern is when it starts to interfere. Okay, and that's what we're going to be talking about as well. So I do like this cartoon with Superman in his later years. Yeah. All right. So now I think there's also a lot of fear associated when I said, there's normal aging and things that are not normal, right? And so when I say the words things that are not normal with aging and thinking abilities, immediately most people's minds jump to dementia, right? Alzheimer's disease. That's what people's minds jump to. And so it's important that we know that even when there are changes in thinking abilities that may not just be normal aging, there are many different things that can affect somebody's thinking abilities other than just dementia. Now, certainly there is dementia. There are many kinds of dementias out there, the most common of which is Alzheimer's disease. So I think it's also important to talk about what dementia is, and we'll talk about that in a little bit. But it's important to know that other kinds of chronic illnesses can also affect thinking abilities. Things like diabetes, high blood pressure, hypothyroidism, all low vitamin B12, all of those things can present with some cognitive difficulties, right? And so it's important that we're aware of those. Other kinds of neurological conditions, Parkinson's disease, having had a stroke or having some TIAs, multiple sclerosis, other autoimmune disorders, seizure disorder, all of those things can affect cognition. And then if you look over here on the right side of my screen, you see a whole host of other things that just happen in people's lives, right? Things like pain, things like stress, medications sometimes, respiratory status, nutrition, injuries that people can get. All kinds of things can have an effect on somebody's thinking abilities. So it's really important to not think of this as things are fine or we're at a worst case scenario, right? It's important to keep those in mind. So dementia, what is dementia, right? So there are many different kinds of dementia. You can think of dementia as an outcome, and there are many different kinds of causes that can ultimately lead to dementia. the most common of which is Alzheimer's disease. So in the United States, the most common cause of dementia is Alzheimer's disease. The second most common is our cerebrovascular disease. And there is some evidence that as baby boomers are aging, we may see that rates of vascular dementia may overtake rates of Alzheimer's dementia in the United States. That seems to be a trend that we're seeing more and more. I think that's certainly true in my clinic as well. There are other kinds of dementias as well, Lewy body, frontotemporal dementia, lots of different ones. So dementia is when somebody demonstrates a significant decline in two or more areas of thinking abilities from their usual ability, right? So the starting point is what their baseline is, their own baseline, not somebody else's baseline, not from absolute perfection, but from their own baseline, if there's been a significant change in two or more aspects of their cognition. And when I say aspects of cognition or cognitive domains, I'm talking about things like memory, language abilities, reasoning abilities, attention, all of those kinds of things. And in addition, those changes have to impact significantly somebody's daily functioning, right? So that's why I said that the dividing line between normal cognition and what's not normal is when it impacts day-to-day functioning. Things that are dementias can be stable, they can be progressive. So for example, Alzheimer's dementia is always progressive. It always starts and continues in a downward trajectory. Vascular dementia, for example, can take different kinds of formats. Sometimes it can be one decline and then it stays stable. Sometimes there are what we call a stepwise pattern of decline, where there's a decline, then things stay stable, then there's a decline, and then things stay stable. It can also take a very similar course as Alzheimer's dementia. So very different kinds of trajectories and outcomes that can be associated with the different kinds of dementias. But another thing that's important to know with most all the dementias is that there is about a 10-year period before somebody fully meets criteria for dementia, even mild dementia, where there are changes that are taking place in their thinking abilities that are beyond what is just normal aging, but does not yet meet criteria for dementia, right? And that's a period that we call mild cognitive impairment. And so it's kind of this middle zone between normal aging and dementia land, right? And so as you can imagine, that is where we really like to catch people. Because if we can catch them in this period of mild cognitive impairment, there's a lot more opportunity to change course and either keep things stable or potentially reverse some of those effects so that it may not ultimately progress to dementia. So that's why it's so important for us to be aware of what some of those changes that might be problematic are, right? So when are those thinking problems a concern, right? Like I said, it's when it begins to interfere with daily life. So when somebody starts having some difficulty carrying on a conversation, that's when I start to be concerned, right? Not just an occasional word finding, but it really starts to interfere in their ability to hold a conversation, to keep up in a conversation, or to remember that conversation after a little bit. And so people who are having trouble with remembering recent conversations that they've had with family or friends, not just remembering every detail, but just remembering the basis of that conversation, they tend to start repeating questions or giving the same stories and information repeatedly. When somebody starts to have difficulty managing more complex tasks that they used to be able to handle easily, that's when we start to become concerned, right? Somebody who has always cooked big meals and suddenly they're struggling with the sequencing of those things. Now, we're not talking about just not wanting to cook, right? That's totally normal, right? That's not a problem. But when the sequencing ability to do that starts to break down, that's when we start to become a little bit more concerned about that. When there start to be errors in like managing somebody's finances, we start to see that bills are being missed or they're being paid to the wrong person or the wrong vendor. When there starts to be those kinds of mistakes, difficulties taking medications correctly, when you start having to get information simplified, that can be one of the indicators that maybe there's some problems in those thinking abilities. Or when complex tasks start to become so frustrating because they're so difficult that one can't complete them. Or it becomes so overwhelming or so frustrating that it's not worth it to complete them anymore. That's when we start to become concerned as well. And then one of the big questions that comes up in my clinic a lot is about driving safety. It's a big one. It's a real big one. And I can tell you that one of the single biggest predictors of somebody who is having some changes in their cognition is when their family members start to become newly uneasy about riding with them. Family members are actually the very best predictor of driving safety. So now, if you've always been a backseat driver to your spouse, that's a whole different story. But when there are new concerns about driving safety, that's when we start to be a little bit more concerned about that. So, as I mentioned, early diagnosis, early recognition of any problems with thinking abilities is really the key, right? So there's some people who historically have thought, you know what, if I've got it, I don't even want to know. I don't want to know. It's better not to know, and then I don't have to know about it, right? Lots of people feel that way. And at times, I think, especially in the past, that was not an unreasonable thing to have or a thought to have. However, there is good research that when dementia, for example, is diagnosed early on, people end up having a longer quantity of life and a better quality of life. It also allows for us to have better diagnostic clarity. As I mentioned, there are many different causes of dementia, but they all kind of end up in the same place. And when somebody comes to us very late in the process, it becomes very difficult to know what type of dementia it is. That's important for treatment, but it's also important to when we're trying to help families know, what to plan for, what the rate of decline is expected to be. Then it's very helpful if we have a better diagnosis. There are medications now that are available, more and more that have been approved all the time, and in fact, a couple just within the last couple of years. There's been some recent breakthroughs, and there are actually a couple of medications, one of which was just FDA approved earlier this year by the FDA to treat dementia. However, they're only FDA approved to be used at the mild cognitive impairment and mild dementia stage. And so if we don't get that accurate diagnosis early enough, we're not able to utilize those kinds of medications if they're appropriate for that person. There's also a factor related to one's ability to actually implement some compensatory strategies, right? So if we find out that somebody has mild cognitive impairment or a mild progression of dementia, we still have lots of time to do some things like some rehab therapies and really shore up some of these different skills and abilities that can help us compensate for the everyday life kinds of problems that the dementia process is causing. So if we know early enough on, we're able to prolong that period of time early on when people have excellent quality of life, and we can prolong that period of time. Our goal is rarely ever to prolong a not good quality of life period of time, right? So also early diagnosis gives more empowerment to a patient to be able to involve themselves in the decision-making process about what they want their future to look like. I would always, always, always rather be able to sit with a patient and their family and help them make some decisions about, do we want to move to an assisted living? Which one? And actually have time to visit and get the feel of different ones, rather than waiting till there's an emergency and we have to take whatever is available, right? It's always better to be able to do it in, a very thoughtful way, and to be able to do it the way that's going to give a patient and their family the most dignity, the most comfort, and to be able to do it the way that they would want to do it. Also, when a patient is diagnosed earlier in the process, their caregivers have better physical health and better quality of life. And that's very important as well, because caregivers of patients with dementia also can have some significant health effects. And so it takes a toll. So the earlier that something is diagnosed, the better it is for really everybody involved. So that's why we do press to encourage folks to get these things checked out earlier on. All right, so what are some of the health risks for dementia? Well, the thing that I like to keep in mind is that basically all the things that are good for your heart are good for your brain. And that's really good news, right? Because it's not like you got to have a whole other set of rules and exercises and restrictions and all that kind of stuff. If it's good for your heart, it's going to be good for your brain as well, right? Now, the most important factors associated with health risks for dementia actually happen in midlife, right? So midlife is the time when those health issues start to take hold and are going on that later end up in the risk of development of dementia in later life. So things like diabetes, for example, is a significant risk factor for dementia. So maintaining really aggressive glucose control in midlife is actually a protective factor against dementia in later life, right? So diabetics who have super good awareness and super good control of it are actually better off than people who were never diagnosed with dementia in their midlife, with diabetes in midlife. However, as we age, hypoglycemic events can become more and more of a risk, right? So the risk of a low blood sugar episode as we get older starts to become more of a risk for dementia and sudden cognitive impairment, as well as many other health risks than the diabetes, than high blood sugar. So things like high blood pressure, high cholesterol, or what we call dyslipidemia, where the good cholesterol is too low and the bad cholesterol is too high. Those can be a health risk for dementia. Obesity, sleep apnea, having a history of traumatic brain injury, and something called ApoE4. So that is one of the genetic factors that is associated with a number of changes in cognition. It is one of the primary genetic risk factors for the development of Alzheimer's dementia. However, it's also predictive of some other cognitive decline as well. So all of those are health risks, right? So the more that earlier in life we keep good control on all of those things, the lower the risk is. But even with those factors, there's still lots of stuff within our control, right? So there are lots of health behaviors that we're able to engage in that reduce the risk of development of cognitive decline. So first of all, what the research tells us is that physical activity, exercise, is beneficial at reducing risk at any point. At any point. Even when people have been sedentary their whole lives and they start a very gentle exercise program later in life, that actually is associated with slowed cognitive decline and risk of dementia, right? So it truly is never too late to start exercising, right? So what that we found in research is that there is a decreased risk of Alzheimer's disease if seniors engage in exercise, aerobic exercise, even once a week, right? Even once a week. Now, obviously, we want you to do more, right? More's better, but even one time a week is enough to reduce risk. So to put in a little bit more numbers, so high levels of physical activity decrease dementia risk by about 38%, but even at moderate levels of physical activity, that's getting almost a third of a reduced risk. So the exercise factor is quite significant. Dietary factors that are associated with a reduced risk of dementia in later life. So diets that are high in antioxidants, diets that are high in fatty acid consumption, more fish consumption, which kind of goes along with some of the fatty acid things, low saturated fats in the diet. The Mediterranean diet has been associated with a decreased risk. We know that from also lots of the cardiovascular risk studies. So again, it's good for your heart, it's good for your brain. There's also something called the MIND diet. And this is something that was developed specifically for reducing the risk of dementia. And it is basically the Mediterranean diet that's low sodium. So that's basically what the MIND diet is. You can go online, you can find lots of information and articles about the MIND diet, but it's essentially the Mediterranean low sodium diet. So that's a shortcut there. Having folic acid intake that's at target levels for somebody's age and gender, that's also something that is associated with reduced risk. Let's see, catch up. Okay, there we go. So the biggest lifestyle factor associated with cognitive aging is actually smoking. And so somebody who is smoking basically has to do all of the other factors to try to bring that risk back up to the same as it would be for a non-smoker who's not doing any of those health behaviors. So the good news of that too is that it is never too late to stop smoking and benefiting from the effects of not smoking. So the benefit of quitting smoking starts within 48 hours on somebody's cognition. So if we test somebody and the next week they've stopped smoking in between, we can already see some changes in how fast their processing speed is, how efficient their memory is, and how good their reasoning ability is. So that's pretty impressive, right? 1 week later, we can see the difference. Heavy smoking in middle age actually doubles the risk of later life dementia. Alcohol consumption. So having no to very low levels of alcohol consumption is associated with the lowest risk of dementia. And binge drinking in midlife is associated with about a 3 times greater risk. So really alcohol, we used to think that it's very protective. However, the evidence on that is really not suggestive that moderate drinking is good. So no to very low consumption of alcohol is the best associated with cerebrovascular health. Let's see, sleep. All right, sleep is a big one. So people who have fragmented sleep, right, where they go to sleep, but then they wake up periodically through the night, and then they're up, and they have to go to the bathroom, and then it takes a while to go back to sleep. Does this sound familiar? Yeah. So that is actually associated with 1.5 times greater risk of the development of Alzheimer's dementia, right? So sleep and getting good sleep is super important. Here's an interesting fact too, though. So sleep is not one of those things where more is always better. So what we see is that people who get less than about 6.5 hours of sleep a night, or who are sleeping more than 9 hours a night, have an increased risk of dementia even 10 years later, right? So it's something that really carries through for quite a long period of time, right? So having people who sleep more It's definitely not always better. It's associated with an increased risk of cognitive decline and faster cognitive decline. Now, we're not completely sure why that is. That's probably because there are other health factors that are causing them to sleep more, but we don't know that for sure. Also associated with sleep, though, is oxygenation status. So obstructive sleep apnea or central sleep apnea, those are significant risk factors for many health effects, including cognitive decline, a faster acceleration of cognitive decline, and the development of dementia. So really identifying and treating sleep apnea, if it exists, it's one of the easiest and most accessible, most modifiable health factors that we can actually impact. So identifying somebody who has sleep apnea, it is tremendous. I had a guy who I had worked with for a long time who we suspected had sleep apnea. And finally, we got him in to get a sleep study done. And he was supposed to come see me the next day. And I had told him, like, hey, sleeping in a different place, like maybe you might not want to come in. It's fine. Let me know. But he came in and he said to me, Dr. Cisneros, I don't know what happened last night, but they came in about halfway through the night and they put this thing on my face and they gave me this drug. And I don't know what that drug was that they gave me, but I have never felt so good in my entire life. There's no drug. He was just getting oxygen, right? There's no drug in there. That was just the effect of actually getting oxygen throughout the night. So people who have chronic sleep apnea show a pattern of cognitive decline that's basically chronic hypoxia. It's starving one's brain of oxygen slowly over longer periods of time. And so that is significantly associated with the speed that somebody's brain processes information and its ability to consolidate memory and to store it, right? So it's easy to see how then those types of things are associated with the development of dementia, right? So sleep apnea, if your spouse is a snorer, you hear them gasping for breath, talk to the doctor, right? We want to get a sleep study. And then there's lots of other factors that are not just diet and health related, but associated with what we call a high cognitive lifestyle. So a cognitive lifestyle is when across somebody's lifespan, they have really just this ongoing engagement with really complex mental activities, right? Now, these can be factors associated with their education, with their occupation, or with leisure activities that really challenge their brain. And this is something that is really kind of an accumulation over the lifespan. Now, here's the interesting thing, though. People who have high levels of education and who had a very cognitively challenging career might think, hey, I'm set. I did all that. Now I've retired and I don't have to do anything anymore. Wrong-o. Because their brains are actually more used to having that challenge. And so it's super important for those folks, even more than others, to keep up that cognitive challenge. So what we see is that the more engaging somebody's cognition is, the lower their risk of dementia is. So people who have what we call a high cognitive lifestyle, which means there's a lot of cognitive challenge incorporated into their daily routine, their everyday life, have a 40% lower risk of dementia. And when we talk about a high cognitive lifestyle, what we're talking about there is people who aren't just engaging in passive activities, but things that actually challenge them, right? Now, this can be anything. It does not have to be a formal kind of program. There are many, many computer apps that they will be very happy to sell you, right? Lumosity is all over the place trying to get people to buy these apps. There's nothing wrong with them. They're fine, but there's also nothing magic about those kinds of tasks other than other kinds of cognitive tasks, right? Jigsaw puzzles, playing bridge, playing mahjong, sewing, knitting, um, learning to play the piano, reading. All of these are cognitively challenging tasks. However, what's really key in a high cognitive lifestyle is that you don't just keep doing the same thing. So, who's a reader around here? I know you are because I got your book, right? So readers love to read, right? And that is a great task. It's a great cognitive lifestyle that you've probably built all across the span of your life, right? It's great. Told my daughter when she was learning to read, you know what? If you're a good reader, you will never be bored in your life, right? Well, that's great. Except that when you get older, it's not enough, because that is actually not that cognitively challenging to your brain if you've been a reader your whole life, right? And so good to keep reading, still better than being a passive TV watcher, but we want to add something different also to the mix, right? So I want you to, start crocheting or sewing or come to a talk and listen to somebody speak at exactly things like this or things out in the community, right? So changing it up and learning new things to challenge your cognition, that's the kind of stuff that we're talking about with a high cognitive lifestyle. And what that does is that it helps to build what we call cognitive reserve. And just like it's really good to have a little extra cushion or reserve in your bank account in case tough times hit, when people have more cognitive reserve, when there are changes in cognition that start to happen, we don't see them actually affecting them till later on. So it's actually not too uncommon that you can see people who have the biological changes happening in their brain, but who are less likely to show clinical signs of dementia when they have higher levels of cognitive reserve, right? And so super important that we do those kinds of things. After retirement, it becomes super critical to actively work on it and actively delay cognitive decline, right? So learning new things, challenging your brain, those are the kinds of things that it's super important, as you may not have the structure associated with working every day that most of us, for most of our life, either going to school or our job kind of forms the structure of our daily routine. Most of us actually just don't do super well without that structure. And most of us need a little bit of a structure imposed on us. And so oftentimes what we're recommending is have a daily routine, right? And it's got some physical activity, it's got some cognitive challenge, and it's going to have some socialization in it as well. So socialization is also one of these kinds of factors that is associated with a lower rate of cognitive decline. So people who have loneliness, people who are lonely, have twice the risk of Alzheimer's disease, and they have a more rapid decline in their cognition when they were followed over a 10-year period. So super important that we keep socializing, and that doesn't just mean with our immediate spouses, right? They already know all our stories. They already know what we're going to say before we even say it, right? They don't count, right? Socializing with other people becomes all the more important. So keeping family connections strong. Now I will say though, so even though it's not enough, people who are married do show a lower risk of cognitive decline. So we want to keep the spouses. We just don't want to only talk to them. People who are active grandparents, people who are actively engaged in the life of their grandchildren, we see that they have stronger cognitive functioning and they hold on to it longer. So those kids, they really do keep us young. So that's really good as well. People who have social activities outside of the family have greater levels of cognitive reserve and better quality of life when they self-report it. And people who have weekly or less often social contact outside of their family, that's been associated empirically with faster memory decline. So now this is one of those places where kind of our own natural inclinations can really come into play, right? So if by nature we're more extroverted, we're more likely to be seeking out those kinds of things automatically. But if you happen to be somebody who's an introvert, it takes more effort to keep those kinds of things involved, right? And so it's important that we pay attention to our friends who might be more inclined to not engage, and we help them continue to engage as well, right? So all the extroverts, befriend your introverted friends and keep them engaged with you, right? People who are actively involved in practicing a spiritual practice also have been found to have slower rates of cognitive decline. So just like it's important to pay attention to your physical health, your psychological health, your mental health, and your spiritual health. All of those kinds of things can be associated with lower rates of cognitive decline. So paying attention to our psychological functioning, also very important. People who have depression have twice the rate of dementia than those that have no history of depression. So super important that we pay attention. It also can be very difficult to disentangle what is depression and what is dementia. So that's one of the common things that people come to see me for, is to help figure out what is dementia, what could be something called pseudo-dementia, which is actually depression that masquerades as dementia, right? So the good thing about this too, though, is that as soon as we start treating somebody who has depression, we see an improvement in their cognitive functioning as well. So that's a really nice thing, right? We have lots of different places that we're able to intervene when we do see some changes happening in somebody's cognition, right? So all the more reason that we pay attention to all of these things. So folks who have a history of anxiety also have an increased risk of cognitive decline, and stress, right? Now, it's really easy for me to say that stress is something that we should all eliminate, right? Well, good luck, right? Right. I don't have that magic wand. I wish I did. But what's important is how we perceive and manage the stress. Most of us aren't out here inviting stress to come into our lives, right? It happens. And so then figuring out the best way for us to manage that, whether that's through some mindfulness techniques or meditation, those kinds of activities can be very helpful in managing stress and then reducing the risk of the effects of that stress on our cognition and our broader physical health. All right, so if I've convinced you and you think, golly gee, I should probably get some help with something like this, lots of different ways for you to go about that. First of all, start with having a physical with your primary care doctor. That's where you should always start, okay? Because there are many different changes and things that can look like dementia, that can look like cognitive decline, that if you get a physical, and they're going to send you to the vampires and get some blood work done, right? A lot of these kinds of things are actually reversible factors, right? So very important that you get your checkup, get your physical, have all that checked out, and so that we know medically what's going on with you, right? Then you can also talk about any concerns that you or your family have with your primary care doctor, right? So then that can result oftentimes in getting a referral on to get some more testing done. So it's important to know that screening tests became very common in the social discourse within the last 5 years. I'd like to thank our politicians for giving that to us. I never thought that the testing that I did would ever be a topic that was coming up in everyday conversation until the course of presidential politics over the last few years. But I'm so glad that it led people to say, hey, there are tests out there that can be done, right? Which Those are great. Screening tests, however, are not sufficient to identify early changes in cognition. And especially changes in cognition that are not associated with Alzheimer's disease are very unlikely to be picked up in screening tests in early cases. When we're talking about screening tests, I'm talking about these like 5-minute kinds of tests. They're great, and if they do identify a problem, there's probably a problem there, but passing one of those tests certainly does not mean there is not an issue that needs to be investigated. So screening tests are not enough. We really need to get a comprehensive evaluation where, first of all, we're assessing what somebody's baseline level of cognition is, right? So if somebody has always had strengths in certain areas and not in other areas, we're not going to hold the things that they were never good at against them now that we're going to test them for dementia, right? I could get lost driving home, right, if I don't use my GPS perhaps, but I always tell my students, don't hold that against me when you're the neuropsychologist and I come back for an evaluation later on, right? Because it's important that we know what somebody's baseline levels are. Everybody is not the same. Also very important that we compare to what is normal in normal aging, right? So what is a normal speed of processing in a 30-year-old is not the normal speed of processing in a 65-year-old, right? So it's very important that we compare to what's actually normal, right? We're not comparing to perfection, right? So those are the kinds of things that we're looking at. And then when I do a neuropsychological evaluation, we're looking at all of the different cognitive domains, right? So things like speed of processing, we're looking at attentional abilities, we're going to look at your language abilities and how you express yourself, how you're able to comprehend information. We look at how your eyes and your brain work together to process visual information. We're going to look at your memory, how you learn information, how you recall information, and then if I ask you questions about it, how you can remember it. We're also going to look at what we call executive functions, which are things like reasoning, problem solving, stopping yourself from saying something you shouldn't say, right? All of those are important aspects of executive functioning as well, right? And so when we look at these test results in the context of somebody's history, then what we start looking for is, first of all, is this just normal? Are they exactly where they should be given what their baseline level of abilities was and for just the changes that we would expect with normal aging? Or has it departed from that normal aging process? And if so, does it look like a pattern associated with a particular dysfunction, right? Does it look like an Alzheimer's pattern? Does it look like a vascular pattern? Does it look like some other kind of pattern? Is this the pattern associated with sleep apnea, for example, right? So very important that we can do those kinds of testing. Also, really, one of the programs that I am so proud of here at Casa Colina is something called the Senior Evaluation Program. It is an interdisciplinary program. Unfortunately, you get to meet with me, but also with one of our physicians who is specialized in geriatric medicine. They do a medical evaluation. Folks get seen by physical therapy, occupational therapy, speech therapy. They get to meet with a social worker, audiology screening, all of these kinds of things so that we get a really holistic view of what a patient's overall functioning is. And then we come back together, we talk about them, and then the geriatric medicine physician and I meet with the patient and their family, and we talk about all of our results and recommendations. For a lot of folks, having your home checked out for safety is something that can be really important. Some of our physical and occupational therapists specialize in doing home evaluations or in giving you information about what to look for in your home that can be a fall risk, for example. So as we age, one of the biggest concerns with protecting somebody's overall health is preventing falls, right? So we put a lot of focus on that. And then finally, we also offer things like driving evaluations, right? So we actually have like a driving simulator kind of thing, and our intrepid driving specialists work with folks in those. And then we'll actually put them in the car and test them out behind the wheel. So lots of different ways to get evaluated, to see if there are problems, and if there are problems, what can we do to change the trajectory, or to give us the maximum quality of life for as long as we possibly can, right? So that's always our goal.